Andrei is HIV positive. He contracted the disease at the age of 19. He spent years fighting intolerance. Now he's fighting for the rights of other sufferers.
There
are methods for treating other illnesses, but there are no rules about how to treat HIV sufferers. Hospitals are reluctant to treat patients because of the costs and lack of understanding. Many people die without getting adequate help.
Russia's HIV crisis is one of the most severe in the world. In the last 2 years, the government's doubled its budget for controlling the spread of HIV, but the number of newly infected people has jumped 10%. One of the main causes is the sharing of infected needles. The Kremlin's called drug use a threat to national security. But the problem appears to be getting worse, not because of a lack of money, but because of how it's being spent. The UN says that harm reduction programs like giving drug users clean needles and using heroin substitutes like methadone that can be swallowed are highly effective in slowing down the spread of HIV. But the Russian Health Ministry doesn't believe these approaches help. They think it's better to try and fight drug dependency instead. They've closed down all needle exchange clinics and even banned the use of heroin substitutes. They also claim that in areas where foreign exchange clinics have been operating, that the actual level of HIV cases tripled. Unfortunately, the ministry has been unable to provide anybody who can answer why. But the moves angered independent health organizations who say the approach will only worsen the problem.
The current system of healthcare isn't based on any real concern for people. We don't know what the ministry's real strategy is at the moment.
This year, UN funding for HIV training and medication in Russia will end. So also will many independent schemes. The Russian government's pledged 0 new infections from this year, but with over 1 million people currently living with HIV, it's a target few expect is possible. Neave Barker, Al Jazeera, Moscow.